Hello, this is Jen with Made Strong Physical Therapy, and what I wanted to talk about today was blood flow restriction therapy or training, or BFR. BFR is something that's relatively new in the rehab world. I guess it's been around for a few years, but it's becoming a lot more common, especially with ACL and kind of post-surgery diagnosis of getting your strength back. So essentially what BFR does, this is my BFR cuff. I'm going to be demonstrating it, but essentially it's like a blood pressure cuff. And what it does, it kind of cuts off your blood flow to a certain muscle, the muscle that you're working, and that allows your muscle to kind of be in an environment. It's a hypoxic environment. That means not as much oxygen. So it's kind of mimicking as if you were lifting really heavy weights, but if you've had ACL surgery, you know that your quad has gotten a lot weaker. And so what BFR can do, like when you're in a position where it's not safe to necessarily load your knee up as much, it allows you to do lower intensity and lower level exercises, but creating an environment as if you were lifting really heavy weights. So it's really challenging, depending on what exercise you're doing. You know, your quad can get really sore, which is great. Again, it's a very safe thing to do. It can be really effective at building your strength up a lot quicker, kind of while your knee and everything is healing. So this is my BFR cuff. So I'm going to demonstrate a couple exercises here. So you would put the BFR cuff right at your hip if you're doing exercises for your leg. So this blows up, and I already have this calibrated and I'll inflate it up in a second, but with BFR, kind of the evidence behind it of like what the most effective kind of pressure is while not getting too uncomfortable is about 60 to 80% of your occlusion pressure. So if you do this with your physical therapist or even on your own with a BFR cuff setup like the one that I have, it kind of links to an app and kind of will give you the directions on how to set everything up, but you need to calibrate your maximum occlusion pressure first. So it will blow up, get super tight, and then give you a number telling you this is your max occlusion pressure. So I think, for example, mine is like 212 millimeters of mercury. So that's at that pressure, that is maximum occlusion where there's no blood going down into my muscles or coming back up. So we're not going to exercise at the max, but we're exercising at about 80% of that. So for me, that's about 170 millimeters of mercury. So, all right, so I went ahead and pumped it up. I couldn't do both at the same time because my phone is recording. But it's pumped up to 170 millimeters of mercury. And so now we're going to go ahead and exercise with it. So I'm just going to do straight leg raises. That's a really common one that you start off with, especially after surgery. But you can do squats with these. Bulgarian split squats are pretty rough. It's a common one that I do. But really anything, especially like single leg exercises where, again, especially if it's an exercise that like maybe causes pain when you're under load, or is an exercise that you're having a harder time with, like kind of decreasing the intensity, and then using BFR is a great way to kind of build up your strength and mimic that environment without overloading it and making things painful, or if it's not safe to do so yet. So, all right, it's already pretty tight. So, I'm gonna tighten up. And so with BFR, kind of the prescription is 30 reps, rest 30 seconds, and then 3 sets of 15 reps, resting for 30 seconds in between each set. So you're gonna do like up to 75, 75 reps. And we're at 10. Whew. So, and it should get pretty hard pretty quick. It's not the most comfortable, but again, it can be really effective. It can make you sore if you're having a hard time getting sore, again, because you may be a little bit earlier post-op. And it's not safe to lift too much, but you still want to get a good workout. You want to feel the burn. Oh my God. 10 more. Last two. Okay, so now I'm gonna rest for 30 seconds. And then I'll start my 3 sets of 15. So depending on, you know, if you do this in PT or if you have a cuff on your own, if it's getting so uncomfortable that you can't finish, kind of cutting the reps down, like I've done 20 in 3 sets of 10, if that's a little bit more manageable, or if your system has the capability to decrease the pressure a little bit to make it a little bit easier so you can complete the reps. Those are a couple options to allow you to keep doing it, but if you're getting to the point of failure where you literally can't lift your leg, that's good, but you can make modifications so you can keep going. All right, here we go. Oh my God. All right, first set of 15 down. And usually I will do this with my clients, like kind of towards the end of the session, because it really can fatigue you and make you really tired. But really you can do this like a few times a week. Again, like changing up the different exercises. I probably wouldn't go more than like 2 rounds of this in one session. Again, just because it can be really intense and make you pretty tired. Okay. Oh my God. You probably see my leg is kind of turning a little bit purple. Normal. Again, if it's like going numb, I would stop. But that will go away once you're done. So don't be alarmed if that happens, or alarmed that is happening to me right now. Oh God. All right. Can I go again in about 10 seconds? This is my last round. Oh my God. Okay. Oh my God. It's rough. And honestly, it doesn't get easier, which is hard. But you know, this is something, like I said, it's kind of more commonly used like the first few months after surgery, but it can also be really helpful. I know sometimes like returning after ACL surgery, kind of getting that last little bit to equalize your legs. A lot of people get stuck at like 80% comparing their quad strength. So BFR and continuing to use that on your surgical leg can be really effective in like closing that gap. And again, there's lots of exercises you can do with this. Straight leg raise is one of them. Really any kind of single leg squats, lunges, like step ups, step downs, leg extensions, leg press. There's a lot of options, and kind of like giving yourself the variety, again, depending on what you're having trouble with, or if there are certain things that are causing pain. Again, especially like graft site pain, whether it's like quad tendon graft I've had on this side, patellar tendon graft I've had on this side. And so like that tendonitis can be really common and really kind of annoying and kind of progressing in your rehab. So BFR can be a really helpful tool to overcome that, or like build your strength to support that a little bit more. So the cuffs that I have, they're called Air Bands. It's through Vald Performance. I do have a link below to those cuffs with a discount if you're interested in getting some of these. I really like them. They have a app that you connect with it through Bluetooth, so it's really easy to follow, kind of easy to adjust the pressure if you need to, like what I was talking about, even within the session. And yeah, they're great. I use them myself, I use them with my clients, and it makes a really big difference. So if you have any questions about this, comment them below. I'm happy to answer anything that you have, because this is a really common thing and a really effective thing. So thanks for watching.